Hello and welcome to Slice of Piefer. Taylor, good to see you.
You too, JP.
It's been so long. Just a few moments.
Mm-hmm.
How was clinic?
Great.
Fabulous.
Mm-hmm.
I got humbled by a femur fracture today. It was awesome.
You ate your humble pie?
I did.
Ah,
It was
Piefer.
a slice of humble Piefer. It was good. We had a challenging subtrochanteric femur fracture that we had to put together, and it was more difficult than I anticipated.
Those
but we
are
came
some of my
together
least
nice.
favorites, if I'm being honest.
They can be a bit of a challenge. You can do them on a fracture table, or you can do them in the lateral position.
Mm-hmm.
More and more people do them in the lateral position to allow the muscles to relax, and perhaps that would have been a good choice. But we got it together. It looks really good. So everything came out nicely. Just
Which
was
one?
A bit of a challenge.
Between doing a subtroch or doing one like an intertroch with a reverse obliquity, what would be your least favorite of those two?
Oh, the subtroch is much more challenging. Subtroch is much more challenging. So.
I really dislike those. I really dislike them.
But I think that's part of it, right? You don't get to pick.
No.
You don't get to pick the easy ones.
But if I had a nickel for every time that I was like, oh, we got to go.
The quick subtroch.
We got to go do a nail and a femur, and I should be home, an hour from now, and then 3 hours later, I'm still there holding an F tool, and you've got a pig sticker and all that.
Oh yes. So nobody knows any of those things we're talking about.
Yeah, an F tool is a specific type of tool we use in the operating room sometimes, and it kind of looks like the letter F, right?
Yeah.
And you wedge it over top of somebody's leg and push down or up, depending on the fracture pattern. But most of the time, the proximal fragment is flipped up, right? Because those muscles are flexing, causing it to flex. And so you're trying to fight that. And it is not fun.
Yep.
So that tool is not super fun. But it's very helpful when some that you're struggling with. And then the pig sticker is a long tool that's got a sharp tip on it, on typically a ball. That you use if you've got, again, a fragment of a fracture that's kicked up and you're trying to, again, you have to then make an additional incision, put that tool in, and then push it down manually. Yep. So if those things get whipped out, that's typically where somebody like me is having to do a lot of holding and pushing.
Yes.
It's even better if you're like 9 months pregnant trying to do that.
You can go like this with the F tool.
Mm-hmm. Mm-hmm. I love it. Yeah, I like that tool. I always like to have it on standby.
Yeah.
Like for those, I just say, hey, don't open it. Just have it there.
Yeah. Let it scare away the bad mojo. Yeah. No, we didn't have to use the F tool. That was good. But I opened it early. So to get down to the fracture, which I typically do with those subtrochs when they're looking nasty. And so
she nasty.
We got it fixed. It came together. She's doing great. I think she's going to be fine. But it was interesting. Yeah. The ball and spike or the pig sticker it's like medieval times, like having Otto back in here.
Yeah. I don't know. It's a pretty, I hate the instrument, but I also like it. But it's not nearly as cool as knife on a stick to me. That's one of my faves.
Yeah, the knife on a stick is a long knife with a yellow handle that can get you all the way down through the fascia, which is that tough lining around the muscle, and get you right where you need to be. So yeah, that's what we did. That's what I did this morning. Still on call. So looks like I get to head back to the hospital here once we get done, which is going to be great.
Meet merp.
I'm assuming that means great.
Yeah.
Nice. How was clinic? Good.
You already asked that already. Are you tired?
I am tired, yes.
Oh, poor Dr. Piefer.
But it was good. What'd you do?
Saw a bunch of patients. Didn't make any silly videos. Didn't do any podcasting until right meow.
Yeah, that does happen. I'm with you.
Gave lots of shots.
Yeah.
Counseled a lot of patients.
Yeah.
Talked some people out of surgery, and then had some people get talked into surgery. Not really talked into it, just kind of let them guide it.
Yeah.
Well, yeah. I mean, and just going over. Sometimes I think what people hear when the internet's a blessing and a curse, right? And so having to go through a lot of like, okay, this is your time. So let's talk about what's important to you. What have you heard? What are your concerns? Let's talk about that. And then having to break that down for patients is something I really enjoy doing because I feel like it's something that I'm passionate about and I like doing it. But it does take a lot out of you to do that, 10 times.
Right.
Because lots of new patients are EP&I or new body part things. So those are a lot of long discussions. Not so much like as many of the like, hey, you're just here for your every 4-month cortisone injection. Bye. You know, not as many of those lately.
Right. Well, and that's a good thing, I guess.
Mm-hmm.
I mean, that's good for us. get to be able to get out there and help people, get people into the office who need to get helped.
Absolutely.
Then I've got the Tuesday, Wednesday, Thursday call schedule this week. So being on call is very fun. Lots of getting woken up in the middle of the night, trauma, so you never know what you're going to get. Maybe it's a femur fracture in an elderly person. Maybe it's a motorcycle accident with multiple fractures. Maybe it's compartment syndrome. Maybe it's a gunshot wound to the hand or something. So we get a little bit of all of it.
Maybe it's a little fight bite.
Fight bite. We can get that too.
We've seen it before. Yeah. Don't love that. It's nasty.
Not fun. Not fun.
No. I saw it more when I was doing like my TDC rotation.
Right.
Like working with people who are incarcerated and getting into fights in jail, and then they show up and they've just got nasty infection on their hands.
Right. Yeah. Being able to recognize that is important for sure. For sure.
Yeah.
Well, we've been thinking about trying to shake up the format of this.
By we, you mean you.
Correct.
I haven't thought about it at all.
Why not?
Because I'm just here.
One of the sections was going to be, what's Taylar thinking about?
Man, that is not safe for work. So
yes,
we are not
it can
going
be safe. So Taylar, what are you thinking about?
Right now?
Yeah.
My Alani.
Yeah. That's not going to sell tickets.
It's bringing me joy, though.
It's sparking joy in your life.
My lunch didn't spark so much joy today.
What was your lunch?
So I tried a new thing that was, so lately if I've been like, I mean, my husband's been out of town, so I haven't been like, I didn't meal prep this week, but it's still, you know, I planned to not fail. So I bought a bunch of like frozen different things for me to try. And so this one today was supposed to be like a lasagna bowl. And the pasta is, I've now realized, made from chicken.
So it's a protein lasagna.
Yeah, and that's why I picked it. The calories were low. It was like 260 calories, 25 grams of protein. I'm like, sold. Let me try this. And it's got sauce and cheese on it. From what I can see, that looks pretty good. But the texture of a chicken noodle is a little off-putting for me, apparently. So I just had to kind of, you know, work my way. I ate it. It was fine.
Tastes like pudding?
No. Tastes fibrous. And so...
Nice.
It wasn't like the most like satisfying lunch on
Right.
the planet.
Yeah.
And yesterday I had a meal prepped one that I had made from like the dinner before, which was
Sure.
really good. So so I spark a lot of joy with what I eat. So
Nice.
So whenever it doesn't live up to the hype, I get a little down.
I live in that world. There's no doubt.
It's okay. I chased it with a string cheese and a.
But now that I have this beautiful continuous glucose monitor telling me every single time that I eat some carbs.
Have you named it yet?
I have not.
Who's your friend on your friend on your arm? We should give it a name.
Farm?
No, Farm's not a good name. It needs to be like Frederico or something like that.
Too
Something
long.
fancy. Is it first? Is it male or female? I think it has to be a dude.
Fine.
You're okay. Fred.
Nah.
How about Gerald?
Gerald the glucose monitor? Still seems long to me.
You want Greg?
Yeah, maybe Greg.
Old
name
Greg.
Name it after one of my friends in Birmingham.
Oh yeah, I was thinking Old Greg.
Also old Greg.
Do you think Old Greg and your friend Greg from
You ever-
Alabama know each other?
You ever drink Bailey's from a shoe?
This is as close as you can get to Bailey's without your eyes getting all wet.
I love the inside jokes. The inside jokes are definitely hitting
Yeah.
with the 70 viewers, of which 10 watch the show.
I wonder how many of our 70 viewers know the Old Greg references, though.
Probably many. Well,
You think so?
a few.
Man, it's like one of those things you just had to force on your friends when you were in college. You're like,
You did.
watch this weird 10-minute video
Yeah.
of a guy that's like a swamp creature wearing a tutu, and
Yeah.
you're going to quote it for the next 20 years.
True.
So you were talking about shaking up the format of the podcast.
Yeah, I don't know. That's what I was going to ask you about. What do you think we should do? Somebody said that someone told me they like the rules, like when we talked about rules, which was, like look at your hand rule and all that stuff, which I think that's good. I mean, those are easy. You could do the rule of the week. That would be fun. What are rules you live by, Taylar?
Is the juice worth the squeeze is the one that I say the most.
Yeah, well,
Yeah, costs nothing to be kind.
also true.
Yeah, I tell my kids all the time, instead of just yelling at them, telling them to like stop shouting or stop whatever, I say be kind. But I say it stern, so I don't know.
Saying, it costs nothing to be kind.
Yeah, there's been this guy that's been popping up on my algorithm lately that's like unhinged things we say to our kids. It's like, if you don't get your shoes on, I'm going to cut your legs off and bait you with them. And then he's like, did I just say that? You know?
That, I have not ever had that thought into my head.
Oh my gosh. I say, when I'm frustrated with my kids, sometimes I say the weirdest things. And I'm like, did my mother just show up here? Like, what is happening?
What do you say?
Oh, all kinds. Nothing I can say on camera.
Say bad stuff to your kids.
Well, I mean, I was raised in the South, and curse words were thrown around a time or two. Like, it's not all PG stuff.
Listen, you live in a PG world.
I live in a material world, and I am a material girl. So no.
That's why you love your Alani and your pink drink.
Dude, there's a new Alani out right now called Lime Slush. I tried it last night. I bought 2. I bought one for me, one for Dan. Dan took 2 sips of his, and he was like, and Dan is not the kind of guy who doesn't finish a drink or anything. Like,
right.
Even if something's he'll still finish it. He was like, no thanks. I liked it. It tastes to me like kind of like a lime sherbety kind of thing, but it was pretty sweet. He did not like it, but I thought it was pretty good.
Nice.
Rules
good.
I live by. Man, that's a deep question. You need to prep me on this before we come on the podcast. Otherwise, you're just going to get off the cuff random old Greg quotes.
I mean, that's fine. I'll take them.
Another thing I live by is, you've seen my downstairs mix up.
Okay.
Easy there, fuzzy little man Peach. I got something to show you. Oh my gosh.
All right.
I was like, I had been at A&M for 1 week when somebody showed me that. And it was one of my counselors from fish camp. So this person I'm supposed to like look up to, and it's supposed to be like your mentor. And he's like, watch this weird video. No preference.
And that's just lived with you for
ever.
Yeah,
yes.
It takes up space rent free in your head all the time.
Oh, for sure.
Nice.
And I send random GIFs of it to my college roommates because I'm like, remember when we trauma bonded over seeing this weird video of this British dude dressed up as a swamp creature?
Yeah. Yeah. So if anybody hasn't looked this up,
you should. Old Greg.
You should. It is.
Yep. Do you love me?
Taylor nails it pretty well.
Could you learn to love me?
Yeah, I agree. I could try. I already do.
Try what?
Learn to love you.
Oh.
Not like that.
Meh. You seen my downstairs mix up. What did it mean to you to see that? Like, and imagine you've just met this person and they're showing you this, and you're
I'm slightly traumatized just because you've said it twice now.
Like, just met these people. You just moved hours away from wherever you grew up, which was me in my case, coming from a tiny, tiny town, didn't know anybody, raised like, again, a little bit by sailors, but still didn't know anybody. And they're like, here, watch this.
And it stuck with you forever.
Forever.
That's good.
Yeah.
That's good. Well, we're doing a traveling podcast next week. Are you so pumped? You
had to bring that up.
Yeah, I did. I mean, you didn't have any ideas, so.
Don't lie to me, boy.
We're going to be, it's a traveling podcast. It's going to be at Hilton Americas downtown.
How far of a drive is that
It's
from
by
here?
our tour. Probably 40 minutes.
I'm just trying to think, by the time I get my kids situated and then get down there, what time I'll get there by.
You'll be fine. Whenever you're there, we'll be good. We have a room. We have the podcast set
And it
up.
starts at 7 a.m. or something?
Registration 7 a.m.
Okay.
But I don't think that first speaker's at 8 a.m. Kevin O'Leary's on at 9.
Mm-hmm.
I think David Meltzer 9:40. Andrew Cordell is after him. Then maybe Dan Fleischman, and then lunch.
Mm-hmm.
And then me.
Gotcha.
Then Marcus Lemonis, several others, and Cody Sanchez.
Are you doing panel after lunch?
Panel after lunch.
Gotcha.
So I'm on the panel, but then we have the room. We have the Emerald Lounge, which I secured myself.
Look at you.
And
balling. Are you going to wear a green velvet jacket to match?
I am going to
Emerald
bring
lines?
it, but I'm not going to wear it on stage. I might wear it in the Emerald Lounge just to make you excited.
Sweet.
I have a great green velvet jacket, but my slacks are blue and it has black on it. So Chrissy would say, number one, that's hideous, but number two, you can't wear a tuxedo jacket with blue pants, with blue slacks.
Did you tell her not with that attitude?
Right. I told her I can wear whatever I want.
I'm a grown man.
I'm a grown man, and you're going to be in Colorado.
Oh, yeah, she's not getting to come.
Taylor's like, if only I could be Chrissy.
Only I could be in Colorado. You know what? Chrissy and I talked, and we decided while you're flying back to do this, I'm going to fly up there and help her with the kids.
Nice.
The teenagers that
Except
don't really need much.
one of my teenagers is going to be overseas in Greece.
Oh, really? That's fun.
Yeah, school trip to Greece. Isn't that cool?
That's pretty darn cool. Darn cool.
So they have some their history teacher's super cool, and they had this opportunity. So we signed up for it last year, and so he and a bunch of his buddies and classmates are going to Greece.
That's super
fun. So that's
fun.
going to be super cool. But then the four of us, the rest of us, are going to Colorado, and then I'm swinging into Houston for one day.
While I go to Colorado.
While Taylor's in Colorado.
Hanging out with Chrissy.
Hanging out with
my best friend.
Hanging out with Chrissy, your best friend. And your children are on their own.
Yeah, good luck.
Good luck, kids.
Yeah. It was funny the other day. I was trying to get in touch with you while you were in the operating room. And of course, I called your phone. You didn't answer. And nobody was watching it. Right? So then I'm like, well, who can I call that is going to be able to get to him? I was like, I wonder if Chrissy's working today. She was. And so she was like, yeah.
It was on a Friday. So she came in. Yeah.
It was awesome.
I remember that. Was she pumped?
Yeah. She was happy to help me.
Yeah.
She's super nice.
I agree.
Every time I call her, she acts like she's like pumped to talk to me. I think she might like me more than you.
That is possible. It's the dashing. It's the glucose monitor, the continuous glucose monitor. It's Greg. Greg the glucose.
Greg the glucose monitor.
Is there there's not a G name that starts with GL. Glenda.
Glenn.
Glenn
the glucose. Nope. Nope. You already see the problem here. Glenn the glucose monitor.
I think I like it better with the GL.
I like Greg.
All right, fine, Greg.
Greg the glucose monitor.
Sorry, Dr. Gregory Galung. My glucose monitor is named after you.
He probably would love that.
He would, especially since it keeps me from eating rice and potatoes.
Which are the devil.
Dear Lord, they're the worst. They spike your blood sugar like crazy. That is for darn sure.
I have been eating a ton of sweet potatoes lately, and potatoes in general. But I've been eating a lot of them lately because my registered dietitian told me that I was going a little too light on the carbs, so I increased that. And you know what? I lost 4% body fat over the course from one in-body scan to the next and kept my skeletal muscle mass the same and lost weight. So, I mean, maybe they're not the devil as much as we thought they were.
For me, currently they are.
Yep.
So
I'm not wearing a Greg, so.
Yeah.
But.
Also, probably your insulin's working.
Probably. Though I do have that, I have the family history and all that, but and when I was in a bigger body, my hemoglobin A1C was trending up.
Yeah.
Which is not.
I hear what you're saying.
Was not the best.
Yeah. It's good lifestyle stuff. Good lifestyle changes. And you're are working with the dietitian nutritionist, exercising 5 to 7 days a week.
No, I wouldn't say I'm doing 7 days a week. I would say that I average 5 days a week.
That's pretty good.
Some weeks, on a bad week that life is crazy, it's 4 days. And then on a week where everything's going perfectly, I may get 6.
That's pretty good. Not taking medication.
Nope.
Awesome. I mean, I think some people need medication to try to help
Absolutely.
get through it. But that's pretty cool that you're able to do it and keep things going.
Yeah. I have tried, I mean, just to be completely honest, I've tried medicine before. I did go on weight loss medication back in 2022, and it worked. I lost weight. I mean, I dropped a bunch of weight. The problem for me was some of the side effects of the medicine, and the keeping that medication going long term from the financial side was becoming a bit stressful. And then I wanted to try like just kind of going off of it and seeing if I could maintain, and I gained it all back and then some. And then when I tried to go back on it, it didn't work.
Really?
I tried it again in 2024, and the food noise, all that kind of stuff was still there. And so that's when I was like, well, that's not going to work a second time for me, apparently, or I'm going to have to go on a dose and have to deal with even worse side effects, which, so anywho, this time I did it different.
I hear you.
Yeah.
Another hip fracture.
Woohoo! Hip, hip, hooray.
What time do I start tomorrow? 1?
Mm-hmm.
Okay, that should be good. But if I get more hip fractures.
Well, and the thing is with the way that your schedule's been lately and that you're out next week, you can't reschedule any of the people tomorrow.
I know.
So.
I do know that.
Mm-hmm.
So that's exciting.
Yeah. Fun times.
But I think the schedule is working currently, at least. Like I haven't had mornings off when I've been on call, if that makes sense.
Right.
Like I haven't, the days that we've blocked clinic, we haven't had, oh, well, I don't have anything to do.
Right.
Right. I've always had surgery.
Yeah.
I've had surgeries. I've had at least 1, 2, or 3 cases to do every single morning.
Oh, yeah.
So,
no, I think that the protocol that we have in place is good.
yeah. So I think that's working, which is good.
Yeah.
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 I think rules will the good, willing the good of the other, I think is still my number one foundational
Back
rule.
to our regularly scheduled programming.
Yeah.
We're gonna talk
Sorry,
about rules
I
again.
randomly went back to that. Also, a recommendation was for rapid fire questions, which we haven't prepared any rapid fire questions today. Besides, what are the rules you live by?
Yeah.
What's your favorite Alani?
Pink slush.
Nice. That was pretty rapid. Well done.
Yeah. I mean, if I
And
can,
are
I
you
can answer
and
questions.
are you excited about the traveling podcast? You just found out today that you get to be part of it. You had been requesting the whole time that you could be a part, and so I accommodated, closed the clinic, so you could come down.
Excited is
It's
not
dead-
the word I would
it's-
use.
That's dead air, Taylor. Dead air. Just sit there.
I say it best when I say nothing at all.
Hey, that's my wedding song.
Touche.
Touche. No, it's going to be fun. We'll have our room. We'll have a podcast station. We'll talk about stuff. We'll meet people. Dan's going to be there
He's
with
going.
his colleagues.
Mhm.
And we'll get some maybe very expensive food.
Popcorn.
And we'll go from there.
I'm going
It's
to
gonna
pack
be
a
good.
lunch. It's going to be great.
It's going to be fun.
I'm going to bring a packed lunch.
I have probably, so one of the things that Aspire wanted me to do is try to get people to come to it. So far, you want to know how many of my very best and closest friends are coming? I'll give you a guess. What do you think?
20.
175.
Nice.
Yeah. So
I thought you meant actual best friends, not people that are coming, just in general. But I forget the golden rule of Jason Piefer is everyone's his best friend.
that is true.
I'm not special. I'm not your best friend.
That is not true. And it's also not one of the golden rules that you're not special.
You're like, Taylor, quit gaslighting me on air right now.
I don't feel like I'm being gaslighted. Gaslit.
Gaslit.
Gasloit.
For some reason, when you said that, my brain went to gasolina.
Me gusta la gasolina.
Yeah, see?
Yeah, that'll get you in trouble too. Not a good one.
No. Once we looked up the lyrics to it, that's the song that came on all the time when I was going to dances. And now I'm like,
Yeah, we can't talk about that.
we don't talk about Bruno.
We don't. Let me see what I'm going to check and see what our other recommendations were. And then we can think about it. We can let our viewership tell us what they want to do. Broken hip. Sorry. Got to go past that one.
This podcast is sponsored by no one.
This podcast is sponsored by Broken Hips. Thanks for coming.
Bring it on down.
Rule of the week. Nice. Show segments. Questions and answers. We talked about that. Rapid fire questions. Yes. Questions on the more technical side
Of
orthopedics.
we have been talking about pig stickers and banana knives and all that. So
Knife on a stick. Yeah.
Yep.
And the F tool.
we did talk
And
about some of that.
subtrochanteric femur fractures.
You could talk
Yeah,
about why
a little bit.
subtroch fractures are so nasty. We didn't really go into detailed
Yeah.
explanation of that. So first of all, subtroch femur fracture means what?
A fracture that is distal
Or below.
or
in
below
this for colloquial, yeah.
because of sub,
Yeah.
like a submarine.
Boom. So sub what?
Below the trochanters.
Which are
See?
the firm part of your bone that sticks out when you feel the side of your hip. That's your greater trochanter right there. So below those bones.
To be differentiated from an intertrochanteric hip fracture, which is a fracture between the trochanters, the greater and the lesser trochanter. If we fracture below them, subtrochanteric. If we fracture between them, it's an intertrochanteric fracture. And sometimes the orientation may even go in the opposite direction, in which case it's a reverse obliquity. Dang it. We are so good. Reverse obliquity gets the sign of the cross. Love it.
Yeah, they can be nasty. But
Yep.
and what's
Not
worse
as bad
is
as
when
the subtroch.
what's worse is when you get in there and you go, "Oh, this is a reverse obliquity."
Yeah.
And you didn't quite get that on the initial imaging, and you're like, "Well, son of a gun, here we go."
Yep.
It's okay though. You just find the motion that
Yeah.
works, and then so subtrochs are nasty because
they the proximal fragment, the fragment attached around the
high.
hip joint, and near the hip joint, gets pulled and flexed anteriorly, sometimes anteriorly and medially, and which makes it very difficult to get the bones to line back up. And what we call that in orthopedics is reducing it, and it is very difficult to reduce. And when you reduce, if you can't get it reduced, then you can't get it nailed. And I have seen in one case, actually 2 cases, someone who nailed the hip with it flexed and not reduced, and the nail will go in just fine, but the bone will not come back where it needs to be, especially in folks who have these fractures who typically have pretty poor bone up top. It's hard to control that bone. So you've got to go open it up, which sometimes for an intertrochanteric hip fracture, we can pass the nail without having to open it up. But
and when he
in
says
this case,
that, what he means is normally we can do all this through a small incision up at the top of the hip. When he says open it up, he means now we're having to go down to where the fracture is and open there as well. So instead of just doing it all through, that top incision and not having to go down and open up where the fracture is, now we've got to add another incision, which sometimes can be kind of small. Sometimes it can be kind of large, depending.
and in today's case, kind of large.
Oh, yeah?
Oh yeah, to get it where it needed to be, it did not want to behave, but it came together nice.
Tell me when to stop. Seriously?
No, about right there.
Okay, that's respectable.
Yeah.
It's okay, Pife. I mucked up a lot of subtrocks in my day too.
This thing looks beautiful. I have the pictures. I'll show you the pictures afterwards.
Perfect. But
Yeah.
anywho, just trying. Yeah. So
Yeah,
getting the
that
reduction
seemed
is
technical enough.
the reduction is hard because you've got those muscles that are attached to
Sure.
the bones up high that are causing it to flex and that are
Yep.
fighting you. You can try to ask anesthesia to give them some relaxing medication to try to get those muscles to relax down. But even when they make them to where they have no twitches, right?
Doesn't matter.
They still are just flexed as the day is along.
And the harder you pull, like to pull the leg out straight, people feel like if you pull the leg straight, you'll pull it and it'll go like this. But when you pull it, it goes like that.
Yeah.
And so that makes it much, much more of a challenge because we need the length without the flexion. And so that's why some people will nail these in the lateral position, which means that the patient is laying on their side without traction. And that may have actually been a much easier choice for me today if I had done that, which I did not.
The more you know.
Yep. There you go. But she gets to weight bear as tolerated, which means she can walk on it whenever she's ready, starting tonight. She's going to be using a walker. She should get healed over the course of the next 3 months, hopefully get going. Most patients who have a hip fracture like this, it is a big deal. Big deal. Because most people take a step back in terms of what their activity level was. They are not able to generally get back to their normal level of activity. Our goal is to get back to the normal level of activity. But most people take a step back, which means if you were a community ambulator, somebody who
could walk around without a walker, cane, crutch, or assistive device.
Right. They go to a restaurant, they go to the movies, they go to the grocery store, they don't have to use a cane. If you're a community ambulator, then you may need to use a walker or cane when you're out in the community. If you have to use a walker or cane in the community, then you may have to do it at home. If you were doing that at home before, then you may have to use a wheelchair because I shouldn't say everybody, but the average person takes a step back. Statistically takes a step back. And that is not easy with any type of hip fracture. So, moral of the story, do everything you can to not fall.
Yep. I talked with a patient about this recently. We were talking about little people, little animals, rugs, all that kind of stuff. And they were talking about how their dog was the culprit that tripped them up or whatever. I said, if I had a nickel for every time I saw somebody who told me a dog tripped them, I'd be a pretty wealthy woman.
Yep, no doubt. Dogs can be dogs and rugs are definite culprits. And I tell everybody, I tell a lot of people, you've heard me say it a million times, nobody gets a gold star for not using their walker and falling.
Bingo.
Yeah, and it is, so just don't fall. That's the key.
Yup. Agreed.
Not that anybody tries to, but man, if you're not thinking about it, especially if you're in a high risk group, especially if you're taking blood thinners, we got to be really careful.
Well, that's why I get so nervous for people who, if we're talking about doing an elective total joint on somebody,
Right.
they're wanting to have like a knee replacement or a hip replacement or something like that. And they're talking about how they get imbalanced and they haven't figured out why they're getting imbalance issues. That always makes me nervous.
Right.
Right. Because I'm setting you up for a potential pretty big complication post-op, not just a hip fracture, but periprosthetic fracture, anything, if we don't know why you're falling.
Right.
Right.
And that happens sometimes. I mean, we got a lot of people who have blood pressure issues. They have AFib. They have, a bunch of these medical terms that orthopedic surgeons aren't supposed to know about. And then, we've just given all of our listeners a lot of things to look up.
Femur.
Maybe we should put a link at the bottom. Would you like us to transcribe this for you in English?
Take it out of doctorese.
Taylor will explain it to you while I go through it the only way I know how.
I said something to her. So I had a little blister on my hand from burning it with a hot glue gun. And so I had a little blister that had popped up. Yeah. And so I trephinated it. And I said that. And one of the staff was like, trephinate? And I was like, I poked a hole in it to get the goo out. And they're like, why wouldn't you just say you poked a hole in it?
I dang poked a hole in that thing and got it all decompressed. It was real nice.
Yeah, I got all that goo out.
Yeah. Also, just so you know, if you don't have a sterile needle,
which I did,
and sterile equipment,
I did,
don't stick needles in yourself.
No. But because of where
do
it
as
was,
Taylor says, don't
my
do
right
as
hand,
Taylor does.
I did it sterile.
No. I'm saying do it.
Yeah.
People don't have sterile technique at home.
I know, but you're saying not as Taylor does, which means that you would imply that I did it inappropriately. I did it appropriately. It's my right hand, and I had a bunch of people that I had to give shots to today. I couldn't have a big bleb on the top of my hand. That's going to get goo on somebody. Right? Excuse me. Let me just get you a napkin.
Napkin? Oh, Lord. We have reverted very far back.
Do you have a napkin drawer in your
what do you
vehicle?
Think about this?
Do you do that?
Think about these eggs.
Do you keep all the napkins you get from restaurants and keep them in a special place in your car?
No.
What?
Do I? Maybe.
You don't if you don't know about it, because they would know where your napkin is.
I thought it was a trick question, like
No.
you found napkins in my car or something.
No.
You usually find trash in your car.
I find all kinds of stuff in your car, but not napkins.
What do you think about those eggs?
What about them? They look great. I like that lightish green colored one. That one's my favorite. It might be a duck egg.
I like the dirt. I like the dirt on it.
That's poop.
So this is nice. I mean, here in Texas, maybe it may not be so common up in the Northeast, Midwest. I think sure. West, yes. Northeast, I don't know.
Eggs?
No, for patients to give you eggs.
Oh,
I didn't bring these eggs from my house. So up in the
Northeast, what you're going to have, especially if you're anywhere near
ostrich eggs?
No, near the Amish communities, they bring chickens and stuff like that to their
just
appointments.
Bring a chicken?
Yes, they try to barter chickens and bread and stuff for their care because they don't have health insurance.
What are you talking about?
One of the doctors I used to work for, one of his residencies was up there, and there was a big Amish community, and he said they show up with like chickens and goats and stuff to try to barter for their surgeries and stuff because they don't have health insurance.
What would you do with a goat?
Eat it. Milk it. You've probably put goat's milk lotion on at some point. That's pretty popular. I bet
only
Chrissy's
if it was expired.
I bet Chrissy's got some of that.
Well, I'm excited about these eggs that I'm going to give to Taylor to take home to her family.
You need those eggs. Take them home to Chrissy. She'll love them.
She will not, but she will. She'll love them. It'll be good.
It's just farm fresh.
Well, we got to come up with some segments. Joke of the day.
What's brown and sticky? A stick.
I don't want to ruin the joke for you.
But cha. So
pick the right one.
Good job. You're getting better. That was the wrong one. I think you probably meant to clap. That would have been more appropriate.
Still too loud for you?
A little bit. It's okay.
Well,
One
we're
of
all good. I think we're going to wrap it up. We'll be at Aspire on Tuesday. Taylor's going to be there. I'm going to be there. It's going to be super fun. If you have suggestions for how we should change the format of this so that we can, we could do arm wrestling. That's been come through here.
I don't want to embarrass you in front of all these people, all
That's
70 people.
You already embarrassed me in front of all these people, Taylor.
How?
Just normally you do that. You
just the way that I am embarrasses you? You're embarrassed of me?
I'm not embarrassed of you. I just say you usually, remember when you just asked what does subtrochanteric mean?
Yeah. How is that embarrassing?
Well, it's not embarrassing to me, but.
That's rude. You said you wanted to be technical and talk about stuff.
I do.
I set you up for that.
You
I
did.
think what you mean to say is thank you, to which I will say you're welcome.
I think what you mean to say is subtroch.
What I also mean to say is you can find somebody else to sit in this seat.
See?
And I could keep seeing patients in that hallway right there.
Boo.
Come on now.
I thought you were so busy, you were overwhelmed.
Right. And
So
if
you
I
need a
had
break.
more time to see more people and to write more notes and do all that
No,
stuff,
I
it
think
would be great.
you needed a break.
Give me a break. Give me a break. Break me off a piece of that.
Kit Kat bar.
Good job. Have you seen The Office where Andy couldn't recall what it was?
Right.
Football cream.
Egg carton. Cream.
Fancy feast.
Fancy feast.
It's my favorite.
I have seen it. Well, thank you again for another good week. We'll see you next week. We may be doing mini podcasts. Actually, mini in two ways. Manny is in MANY and mini as in short. So like 5-minute to 10-minute podcasts with people who come in. And
I'm
Taylor's
just
going to
let
be
that slide.
What?
Manny.
What's wrong with Manny?
Manny, like MANY.
Well, I say many and many the same way.
Manny. Like manly, but
Like
manny.
mayonnaise. Like mayonnaise.
Not better.
What's wrong with mayonnaise?
It's not. It's the way you're saying it.
Mayonnaise? What's wrong with that? Is that not how you say it?
It's perfect. Go ahead.
How do you say it?
I'm good.
Mayonnaise?
This podcast is going to go on forever if we don't wrap it up.
But I feel like now
You said I
really-
was embarrassing you earlier, and I'm trying. I'm
now
trying
you really
to stop.
now you really are. I like it.
I'm trying not to.
What's wrong with mayonnaise?
Mayonnaise.
That's how I say mayonnaise. How do normal people say mayonnaise?
You are normal. You're fine.
Everyone in the audience is wondering. How do you say mayonnaise?
I like the tangy zip of Miracle Whip.
It's not mayonnaise.
That's Stanley. It's another Office reference. Mayonnaise.
Mayonnaise.
You sound like you're saying man-haze.
Mayonnaise. Huh. Never thought of it that way.
That's why I was saying we can move along. We don't have.
All
I
right.
don't have to embarrass you.
Who says mayonnaise the weirdest? I think it's Taylor. I think we actually say it exactly the same. I think maybe you just can't hear.
Well, you did blow my eardrums out with a couple of those sound effects, so that's
Nice.
also a possibility.
Very true. All right. We'll try to wrap it up one more time. Would you like me to get you a mayonnaise sandwich?
No.
We'll see you next week. Aspire Tour. If you want to come,
Many.
let us know.
Many podcasts.
We will do many podcasts. We'll do mini Manny podcasts. Taylor is losing it, and I have no idea what the joke is.
Manny.
I'm trying to differentiate between mini and mini.
Bravo on the enunciation. You're doing great.
Dear Lord, people. What have I gotten myself into? Thanks for
I don't
being
know. I
here.
ask you this all the time. You really could do better.
I don't think that's true. All right. Well done.